Assalamu alaikum. My name is Rachel Abedi, and it's a real pleasure to be part of this conference and the wider conversation about Muslim mental health. I'm sorry not to be meeting you all in person, but really glad to have this opportunity to join discussions remotely. I have worked in a London CAMHS, which is the Child and Adolescent Mental Health Service, part of the UK's NHS, for 5 years, while training as a child and adolescent psychoanalytic psychotherapist at the Tavistock. Partly as a result of my exploring my own identity as an English Muslim, training as a psychotherapist, which is a profession often associated with secular thinking, I became interested in how perceived identity might affect engagement between clinicians and patients and what might get in the way of relating. Although there's not much data about how Muslim children and families engage with CAMHS, what there is suggests that we have a problem, particularly in psychotherapy. I decided to use my ProfDoc research project to look specifically at how clinicians think about their Muslim patients, in order to learn something about how our attitudes, assumptions, anxieties operate in a clinical setting, and what we as mental health professionals bring to the therapy room when working with Muslims. Might this be making it more difficult for Muslim families to approach us for help? What can we do to make our service more accessible? My research question was, how do CAMHS clinicians respond to the faith identity of Muslim patients and families? It's a qualitative project, data gathered by interviewing 8 clinicians in my multidisciplinary team and analysed using IPA. Before I began, I first wanted to find out from Muslim adolescents about whether they felt that being a Muslim was relevant to their mental health and emotional well-being, also their thoughts and feelings about engaging with health services. Do they think that being Muslim makes any difference? I ran some workshops in schools and in the community to explore these questions, and then I used their responses to inform my interviews with clinicians to make sure that my questions reflected the concerns of young Muslims. The themes arising from these workshops are on my poster, and so are the key themes that came out of the interviews with clinicians, who included psychiatrists, clinical psychologists, systemic family therapists, specialist nurses, and psychotherapists. I'm still in the process of writing up, and I hope to complete in September. Meanwhile, please do get in touch if you have any questions. I'd love to hear from you and discuss the area and learn more about how services can be made more accessible to Muslim children and families. Thank you.